Yeah, I apologize again for the technical interruption. Thank you for being patient and staying with us. Maybe you can reward yourself by posting some questions or making a remark, and you can claim a free gift from Eucerin, the soothing cream that's worth 65 ringgit. Anyway, where we left off was I was mentioning about certain bacteria and viral infections causing exacerbation of eczema symptom. Actually, it's not only causing exacerbation of the symptom, it's actually a very what do you say? It's actually a very dangerous condition whereby if the eczema skin gets infected by a virus, can be a herpes virus or a varicella virus, any sort of virus, it can actually cause a very severe illness. And these conditions needed to be attended to by medical doctors. Also, same thing with bacteria like staphylococcal bacteria affecting the eczema wound. It can cause severe infection, and this needs urgent medical care. Lastly, we will discuss a few more things that can, few topical agents that that tends to be common aggravators of the symptoms of eczema, trigger factors of eczema. One of them being detergents and soap. Inside detergents and soap, they are very strong chemicals that actually washes off the natural lipid layer of the skin that helps retain water. Just imagine the skin of the eczema patient is already dry, and by further exposing the skins to soaps and detergents and washing off this natural protection layer to retain water, the skin will become even drier, and hence it is because of this that causes the eczema symptoms to be worse, or it may start a new bout of eczema attack. Not only that, it causes washes away the natural protective layer. It is also a kind of very strong irritant. It can cause what we call allergic dermatitis, which is actually an allergic reaction or irritant dermatitis. That is irritation to the material per se, causing a localized eczema eruption. Also, somehow it is important for me to point out here that I've mentioned over my last few talks that moisturizers are very important to help patients with eczema to increase their water content in their skin, to make their skin healthier. It is important here that I point out that not all moisturizers are the same, especially a lot of over-the-counter moisturizers. They tend to have a lot of what we call certain fragrances and preservatives in them, and also certain solvents in them that can actually worsen eczema. So it is again important not to simply purchase moisturizer because it can be counterproductive. One of the few good moisturizers that you can get that are clinically tested one will be Eucerin in the market. So you can look them up in any pharmaceutical stores, or you can consult your pharmacist for any other moisturizers that are clinically proven. Again, not all moisturizers are the same. Some tend to contain a lot of irritant in them, especially those with fragrances. So it's not only non-beneficial to the eczema skin, but it's also counterproductive, and it can worsen the symptom. It is also how do we say important to know that certain decorative items on the skin can cause a localized eczema or a generalized eczema eruption, especially let's say, for example, certain jewelries that may contain nickel, or even certain belts or bracelets that may contain nickel are one of the common ones that can aggravate eczema. If you have such jewelries or any decorative items that seem to be triggering eczema, my advice would be put them away, or when you purchase them, try and consult the merchant if they contain nickels or certain allergic product to it, and this should help prevent the trigger by that particular factor in the decorative item. Again, trigger factors, there are many other trigger factors that we have not discussed here today, but again, if you suspect any form of trigger factors that are not mentioned here being one that causes your eczema, please consult your local medical doctor. There are tests that can be done to prove that it is the cause. However, medical advice will be needed on that. So that basically concludes a few points that I want to talk about regarding trigger factors of eczema today. So without any ado, we'll proceed to the next session of the talk, which is question and answer session. Feel free to post the questions. I'll do my best to answer them. I'll address the poster by name and I'll try to answer your question to my best ability. Right, so we'll take the first question. Maybe you can try and bring it over here a bit. This side. You can see. Can it over here a bit? Right, sorry. So this one. Choguat Tan posted a question. Dear Dr. Ng, I'm a 64-year-old lady. My skin becomes very dry and sometimes flaky, something like eczema after shower. I'm currently using shower oil. Any recommendation? Thank you. Okay, in this question, you will notice that she mentioned that she's about 60-year-old plus. Again, this has not only got to do with eczema, but this has got to do with the general skin condition per se. Okay, we'll start off by saying how our skin ages and how our skin loses water with age. As we age, the tendency for our skin to retain water become less. And then throughout our lifetime, most of us anyway, have been educated to use soap to clean up, to take a shower, and make sure we are really clean and things like that. But it's also because of this lifetime exposure to soap that it actually aggravates the skin dryness. Again, when we age, our skin becomes drier because our skin loses tendency to retain water. That's one, and we actually make this condition worse by using a lot of soap on our skin throughout our lifetime. So by the time we get to about 60 plus, some even 50 plus, we will start to feel that the skin become itchy. This is a kind of eczema, but it is not called atopic eczema. There's another name for it. It's called steatotic eczema, but it has to do with the dryness of the skin. What can we do with this skin condition? One is, the most important thing is to prevent, meaning patients that are still in their early teens or maybe in early adulthood should try not to use soap on their skin. Use something more gentle. Use a proper skin bath or skin oil. Eucerin also do have these products, certain bath oil that is pH more balanced to the skin. It doesn't wash off the protective layer of the skin and hence doesn't aggravate the skin dryness. That is the most important thing to do, prevention. And number two, for patients that are already actually living the condition, that means already they have the condition, what you do is you try and moisturize your skin well. Some topical corticosteroids can help, but please consult a doctor because you may need slightly longer term on that. I mentioned the bath oil, I mentioned the corticosteroid, and of course a moisturizer is very, very important. And of course no soap for your skin anymore. And hopefully in time, and when I say time, usually about a couple of months, even up to a year, you should start seeing some improvement on the skin condition. There's no fast way to it. You just need to be patient and persevere with the treatment of re-moisturizing your skin. And you mentioned something about flaky skins. Sometimes on top of this skin, you can get secondary infection. If you do have those, perhaps you really need a doctor to have a look at your skin and see if anything can be done, right? The next question will be Chen Chong. I'm an office clerk. I suffered dryness of my skin. I've applied a lot of lotion, but it did not last. What is the solution to that? Well, just now we mentioned about environmental temperature being a trigger factor of eczema. But environmental factor also can be a factor to cause dry skin. Dry, humid air, especially inside offices, exposed to aircon 7 days a week or 5-6 days a week, can actually aggravate skin dryness. Usually, a good moisturizer will last you that amount of time while you're in the office. So perhaps maybe your moisturizer may not be up to that standard you demand. Maybe it's a time for you to look at something else in the market. Try and get a clinically tested moisturizer. A proper one should keep your skin dry while you're in office. You can also help by reducing the skin exposure to the cold environment itself by putting on a jacket. It helps retain certain humidity inside the jacket and helps the skin in a way. Question number 3, Miss Penny, may I know what detergent is recommended for eczema patient? First of all, there is no recommended detergents for eczema patient. Best to avoid all of them. If you need to use any form of detergent, try and wear a protective glove before using it. Of course, again, some patients are allergic to glove, latex allergy, but it's also again very uncommon. If you have that, then that will be a bit of a headache. If you don't have that, please wear a glove and before you use any form of detergent. Right. Part 2 of the question. And is it true that someone who had eczema can't apply any cosmetics or perfume? It's not totally true. Like I say, different patients react differently to different fragrances and perfumes. It is well known that some fragrances and perfume causes eczema worsening. If you have used, let's say, brand A, and it causes the allergic to it, maybe you try avoid it. You can try again with some other brand. But if your eczema is severe and it reacts to all of them, then yes, you have to stop it. Again, it depends on the individual, so you have to look into that. Next question, Wailun Cheong. Doc, is swimming a potential trigger for eczema? It can be a trigger because in the swimming pool they have a lot of chlorine. It can be a skin irritant. But again, what I recommend some patients to do who their hobby is swimming is apply a good protective layer of moisturizer before let it dry and absorb in the house before going off to swimming. And after swimming, after you take your shower and everything, reapply a layer of moisturizer. Some of them can be something like the Eucerin one, so you have a protection before you go into the water. Come out and you apply the protection. It will help in a certain way. New question. Sini Wong. Hey doctor, is this eczema? Sorry, does eczema only happens to children and not to adult? Yes, if you've heard my talk earlier, usually eczema start in childhood. It's an inherited condition, and by teenage years, about 12 to 15, 65% of them actually achieve certain resolution, but it can recur in adulthood because of trigger factors, and if you are exposed to this, then there is a higher risk that you can get your eczema back. So eczema affects not only the children but also adult. But if you take care of eczema well in childhood, get a good control of it, nurse your skin from young, increase the water content of the skin from young, it has been shown that it gives a better outcome during adulthood days, right? And another question, same by Mr. Wailun Cheong. I heard that patients with eczema will have flare-up stage and normal stage. Is it true? If it's true, do I treat it? Again, yes, like I've mentioned earlier. Okay. Basically, maybe we explain it in this way. Let's say if a patient has first bout of eczema attack, when you see a doctor, the doctor will prescribe whatever that is needed, topical medication, oral medication as well, maybe, to get a control on the eczema, to induce a cure at that point of time. So during the attack, you see a doctor, the doctor treats eczema, you get a cure, and that's it for that bout. Then from then onwards, you have to take care from being exposed to any potential trigger factors. And again, if the flare-up recurs for whatever reason it may be, yes, you need another bout of treatment to induce a resolution again. So basically, simply put it, every bout of eczema attack or recurrence need proper treatment. Why you need proper treatment, and also not only proper, but you need early treatment, because it not only increases the recovery rate, because you treat it when it's still at its infancy, it actually gives you a better outcome. So imagine a rash that is only a spot size of, let's say, maybe a 20-cent coin. If you attend to it earlier, it should resolve faster. Then if you leave it a couple of months, 20-cent coin will become size of like a 50-cent coin. There can be skin thickening. If I mentioned earlier also in my earlier lectures that there can be skin thickening eczema, and this tend to make the eczema harder to treat and last longer. So again, if you attend to it early every time, the outcome is much better. Miss Penny didn't hear the answer regarding her question. What detergent is recommended for eczema patient? There is no detergents recommended, I said, for eczema patient. But if you really need to do detergent, we understand, because some patients, they have to do housework. It's unless nowadays they have a lot of household help. If you don't have those, you will probably need to protect your hand properly. Wear a glove before you use the detergent, right? Uh, is it true that someone who had eczema can't apply cosmetic or perfume? This is again individual, different from each individual. Most of the perfumes and cosmetic product can aggravate eczema, but there are some that are less allergenic. There are too many in the market. I will not be able to tell you which one. The only thing is routine trial and error. But if you find after a few trial and errors also it irritates your skin, then it's best to stop it all totally. Okay, I hope this time you can hear me. Okay, Mr. Wyland again. Will steroid burn my skin after prolonged use? No, it will not burn your skin. That's definitely no. There is a truth and also misconception about steroid use and the danger of it. The truth is chronic steroid use, that means long-term steroid use, maybe long-term potent steroid use can cause skin thinning, and skin thinning is in a way irreversible. That's why if any patients were to use any steroid, I would recommend them to consult a medical doctor. We can get a lot of steroid over the counter nowadays in Malaysia, which is definitely not the way it should be, but it's out of our scope of discussion. So always consult a doctor if you need to use topical steroids. It does not burn your skin, it causes skin thinning, the potent ones. But a lot of time, I also say that this is a misconception, because under my care, most eczema patients, and I'm sure under a lot of other medical doctors' care, most eczema patients use steroid happily without any complication. So I would like to reinforce to you that do not fear using topical steroids if you need to, but the important thing is get proper medical consultation and medical care. And what you can do actually to help the potency of the steroid, that means help steroid work better, is by applying moisturizer on the skin before using the steroid. Because once your skin is moisturized, is wet, the absorption rate for the steroid is better. So the outcome is definitely better because more medications actually gets into the skin, right? Next question will be Miss Liu Xiao Pan. Experts do recommend to try eczema diets, but how helpful are these eczema diets? I will have to say that I'm not too familiar with eczema diets, but I've read a couple of articles on it. I think the verdict is still out on that. But if let's say in terms of diet, I would like to advise patients to look out for any potential allergens in your diet that can trigger eczema. Example being, let's say if you take let's say a crab or prawns and you get an exacerbation of eczema, then your diet automatically needs to exclude prawn and crab indefinitely. You can test this. There is a skin allergen test to it, or there can be a blood immunity test to this kind of allergens, but it's you need to consult a medical doctor. Regarding the diet, again, I will have to follow up on that, or the verdict is still out on that, right? Miss Teresa Chong, how is eczema diagnosed? Eczema is diagnosed actually by clinically. Most of the medical doctors will look at the patient on presentation, examine the skin, and through history, question the patient on how it started, where are the locations of the eczema, and from there, usually the doctor will make a diagnosis of eczema. Only severe cases, there are ways that can be done to really get the proper histological diagnosis. That will involve a biopsy of the skin, but I believe no medical doctors actually do that. Most of it is done basically by clinical examination and history. Only certain cases may require a biopsy. I can't pronounce this patient's this name, but the question sounds like Will stress trigger eczema? Just personally, I feel it made my eczema worse. Yeah, earlier in the talk we mentioned that stress is a trigger factor, is a known trigger factor of eczema, and how exactly it works, we have not been able to prove it yet, but it is believed that stress increases inflammation in your body. I've explained earlier, stress actually increases a stress hormone in the body called cortisol, and this increases the body inflammation. And eczema being a inflammation skin condition, it actually worsen it. Imagine inflammation and inflammation, it actually worsens the condition of the eczema. So yes, stress does worsen the eczema. And if you find yourself a bit stressed, maybe you can Google up some relaxation techniques that you can, basic ones that you can follow. If it helps, then it'll be good. If it not, if it doesn't help, seek medical advice again. Oh, okay. So now, do we have any more questions at the moment? All right. So I think that was our last question for today. So this will be the end of our live chat today. This is our third session. I hope I've helped clear most of your questions. Thank you for tuning in. Yusrin is very happy to bring this live chat to you, and they will be sponsoring a free gift to every person that have logged on or posted a question, a soothing cream that is worth 65 ringgit. If you have missed out the Q&A question, and if you have any other question, you can PM Yusrin Malaysia on Facebook, and also you can still claim your free product there. Once again, we thank you for participation, and also we'll see you in the next session of the live chat. That will be the fourth session about the same time, 1 month from now. Do check out on the Facebook on the exact date, and have a good day. Goodbye. Right? Stop podcast.